Hi friends, we are going to discuss all these psychiatry questions which were asked in a recent INI CET paper. So the first question, a 53-year-old male, a chronic alcoholic person who tried to stop taking alcohol after several requests by his family members. After quitting, he started feeling uneasy, nauseating and headache. He is brought to hospital on day 3. See, this is very, very important. On which date he is presented to? On which day he is presented to hospital? When he started having cloudiness of consciousness, basically altered sensorium, visual hallucination, insomnia and secondary delusion. Psychotic symptoms are also there. He had attacks of seizures also. Okay. During the examination, he was shaking and having profuse sweating. He was agitated and abusing the people around. Which of the following is appropriate line of management for this patient? First of all, you tell me what is the diagnosis. Easily you can understand that these are what? Alcoholic withdrawal symptoms. Very easy to understand. As we have learned that, what are the withdrawal symptoms which occur after cessation of having alcohol? So the first symptom, first withdrawal symptom which occur when the last peg a person has had 6 hours before. So first symptom will occur after 6 to 8 hours. So what is that symptom? First and most classical symptoms, right? Okay, fine. After that, if a person has stopped taking alcohol, or if he had the last peg 12 to 24 hours before, so what will be the symptom? Hallucinosis, right? Hallucinosis. Okay. And if he had the last peg 24 to 48 hours before, now he will be having seizure, which is also called the cluster seizure, or you can say RUM fits, right? GTCS. Or if he had the last peg 48 to 72 hours before, now he will be having what? Altered sensorium, clouding of consciousness with visual hallucination, auditory hallucination, even the tactile hallucination. Fine. So this altered sensorium, this is called as what? Delirium. Which type of delirium you see in alcoholic withdrawal symptom? This is DT, right? Delirium. Very good. You can easily understand it, right? Okay, fine. So now tell me, what about this patient? He is presented around 72 hours after cessation of alcohol on day 3, right? So the diagnosis which we are going to make here is what? What is your answer? Yes, DT. How to treat the patient? So how to treat the patient? Since patient also had this seizure, right? So first of all, we have to give a benzodiazepine. Along with that, we have to add one vitamin. We have to give thiamine injection. Thiamine injection. Why we are adding thiamine? So that we can prevent the development of Wernicke's encephalopathy, right? Okay, fine. So out of these, what is the most appropriate line of management? Yes, we have to give diazepam along with thiamine injection. Easy to understand? Next question. After death of mother, a 14-year-old girl got blind. Suddenly she got blind, but she does not bother about it. She is unconcerned about her blindness. During examination, she was found to be normal. She was upset and talking only about her mother, with whom she used to fight a lot. Which of the following is a right statement related to her condition? First of all, you tell me, what is the diagnosis here? See here, acute onset of symptoms just after psychological stress, where a person is unconcerned about the result, indifferent to the result. This is called as what? 𝗏𝗵𝗃 indifference. This is called as 𝗏𝗵𝗃 indifference, which is seen in which disorder? Acute onset of symptoms, sensory motor symptoms just after psychological stress. This is called as what? Dissociative disorder. This is called as a dissociative disorder, which is also called as conversion conversion disorder. Old name was hysteria. So what is the meaning of 𝗏𝗵𝗃 indifference? See, if a normal person loses one eyesight, obviously he will be very much worried about the blindness in one eye, right now, and as soon as possible he would like to meet an eye specialist, right? But patient of dissociative disorder is indifferent to the result. Even after losing one eyesight, okay doctor, no problem at all. She will not be bothering about the blindness. She will be talking about something different. Yeah, my mother was like this, my mother was like that. This is called as 𝗏𝗵𝗃 indifference. This is more common among females. Adult or child, but more common among females, right? So out of A, B, C, D, what is your right answer? Females have higher incidence. Okay, now next question. Find out the right match here. So all these are what? All these are related to impulsive control disorder. Impulsive control disorder. All these are recall questions as informed by the medicos who wrote the exam, right? Some students said that like nymphomania was not there, so there was a mutilomania, right? So where you have to, where a person is mutilating the animals. Fine, so okay, whatever. So we have to match the following. Fine. See here, pyromania, kleptomania, dipsomania, all these are impulsive control disorders. So nymphomania, this is sexual disorder. Okay, let's understand this. So what is the meaning of impulse control disorder? Where a person is having irresistible urge to perform it, which can be harmful to others, right? Until and unless he is not performing the act, he will not be relaxed. He will not be satisfied. Fine? Fine. So first of all, pyro means fire, है ना? Pyromania. Until and unless if a person is not setting something on fire, he will not be relaxed. He will not be comfortable. Fine. So pyromania means what? Obsessive desire to set fire to things. Okay. So first is B. Now nymphomania. Nymphomania is what? Excessive sexual desire in females. Excessive sexual desire in females. What about excessive sexual desire in males? Yeah, that is called as 𝗏𝗏𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃 Yeses. So nymphomania is excessive sexual desire among females. Okay, so 2 is C. Now, kleptomania, irresistible desire to steal something. When I talk about stealing something, see, it does not mean that the thing should be very, very expensive. No. See, even this can be a tissue paper. So here you cannot say robbery is also a type of kleptomania. No, here patient is having irresistible urge, steal something, even if it is a pen, pencil, or tissue paper, whatever it is. He or she has the irresistible desire, steal it, right? This is kleptomania, right? Kleptomania. So 3 is D. Now dipsomania is irresistible desire to drink alcohol, right? Okay, fine. So 4 is A. 1 is B, 2 C, 3 D, and 4 is A. So right answer is C. Next, again this question is related to alcoholism. So this time from substance abuse and especially alcoholism, they have asked 3 questions in INI CET. Okay, question number 4. severe alcoholic person who was using 1 bottle of whiskey every day. He stopped consuming the alcohol for last 2 days. Lab investigation shows deranged liver function test. Which of the following drugs should be used for detoxification? See, whenever you are going to manage a case of alcoholism, yes, first of all, you have to do what? Detoxification. And after detoxification, you have to maintain the abstinence, right? You have to maintain the abstinence. Fine. So in this question, examiner is asking which drug is used for detoxification when a liver function test is deranged, when liver function test is abnormal. Do understand here that drug of choice for detoxification is, obviously you have to give a substitute for alcohol, which is benzodiazepine. So drug of choice, so the benzodiazepine of choice is what? 𝗏𝗏𝗏𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃 Second, you can also use diazepam. है ना? Diazepam. Why you are using chlorodiazepam epoxide and the diazepam? Because they have longer T-half. Okay, fine. But these drugs can be used when liver function test is normal. But in this question, patient is having what? Abnormal liver function test. It means liver damage is already started. So please understand that which benzodiazepines are safe when liver is damaged. Safe benzodiazepines are lorazepam and oxazepam, right? Oxazepam. These two are safe. Please understand that chlorodiazepam epoxide and the diazepam, these are metabolized via oxidation and the glucuronidation. Fine. But lorazepam and the oxazepam, these two are following only one pathway. So they will be having less stress on liver. So these two are safe in a case of liver damaged patient. Fine. So out of these four, which option you are going to choose? What should be the best management here? Yes, you are going to use lorazepam. This is repeatedly asked question. You can be confused by chlorodiazepam epoxide, but do remember, if LFT is normal, you can use chlorodiazepam epoxide. If LFT is abnormal, you have to use either lorazepam or oxazepam. Okay, next question. How much therapeutic dose of lithium should be maintained in a case of long-term bipolar disorder? Okay, so here examiner has asked use of lithium in a case of mania, in a case of bipolar disorder. Lithium is very, very important mood stabilizer. Okay, fine. Lithium is very important drug related to your exam. Every time they can ask one question related to lithium and the lithium toxicity, lithium plasma concentration. Lithium is the mood stabilizer which can decrease suicidal tendency in patient of bipolar disorder by 80%. Lithium is a mood stabilizer which decreases suicidal tendency. In the same manner, when I talk about antipsychotic drug, which antipsychotic drug can decrease the suicidal tendency in a patient? Clozapine. Okay, clozapine. Remember that. Okay, fine. So now when we know about lithium, that lithium is a toxic drug. So whenever we are going to give lithium to a patient, we should always be careful. We have to do TDM. What is the meaning of TDM? Therapeutic drug monitoring. Because whenever we are using any toxic drug, we have to keep on following, we have to keep on monitoring the plasma concentration of the drug, right? Therapeutic drug monitoring should be performed when plasma concentration level is achieved. Fine. How much is the half-life of lithium? Half-life of lithium is 1.3 days. Okay. And plasma concentration will be achieved only after 3 to 4 half-lives. So please understand that lithium achieves its plasma concentration only after 5 days. So easily we can understand that TDM in a case of lithium should be started after 5th day. Easy to understand? All right. Now the question is that how much lithium plasma concentration, I'm repeating. Now the question is that how much plasma concentration of lithium should be there in a case of acute mania so that it should be supportive to the patient. In a case of acute mania, plasma concentration should be what? Should be how much? 1 to 1.5 milliequivalent per liter. In a case of acute mania. But in a case of long-standing bipolar disorder, where we have to maintain it. So maintenance dose is 0.6 to 1.2 milliequivalent per liter. Right now, this is for maintenance therapy. Maintenance. And this is in a case of acute mania. Right? So out of these 4, which one is a better answer? Yes, option number B, 0.6 to 1.4 milliequivalent per liter, because after 1.5, signs of toxicity will be starting, right? Okay, question number 7. See, this is a very easy question related to depression. Which of the following is right about depression? As we know that depression is more common among middle-aged people. Middle-aged people, especially among females. When I ask you, depression is more common among men or women? Very easy to understand. See the ratio. Male is to female. Yes, depression is more common among middle-aged females. So now you can easily solve this, no? Adult females more than adult males. Very easy to understand. Okay, now next question. All of the following are true about a disulfiram except. Again, one question from alcoholism. See, in this inicet, 3 questions were asked from alcoholism. So I can say that in substance abuse, most important topic is alcohol, right? So you cannot miss learning it. Fine. See, initial dose is 250 milligram. Okay, so like this is the fact which we know. It causes accumulation of acetaldehyde. This is not an anti-craving drug. It is alcohol dehydrogenase inhibitor. Very easy question and we can easily solve it. So whenever you are going to get a patient of alcoholism, how you are going to start the management? First of all, you have to do the detoxification. After detoxification, basically it will take 7 to 14 days for complete detoxification. Basically, you are going to purify the blood, right? Alcohol-free blood, right? After that, he should not use alcohol again, fine? So you have to maintain the abstinence. How to maintain the abstinence? You have to give one medicine which is a deterrent agent. But suppose if the patient is high profile patient, at that time you have to use one more type of drug that is called as anti-craving drugs. Anti-craving drugs like the anti-craving drugs like acamprosate, baclofen, right? And the naltrexone. Okay, fine. So now let's understand the metabolism of alcohol. Alcohol will be converted into acetaldehyde. Acetaldehyde will further be converted into acetate. Acetate will be converted into CO2 and H2O. Now the question is that whenever there will be the conversion of alcohol to acetaldehyde to acetate, obviously one enzyme has to play a role in between, right? So alcohol to acetaldehyde, yes, there will be one dehydrogenase, alcohol dehydrogenase. And now for the conversion of acetaldehyde to acetate, there will be aldehyde dehydrogenase. As we know that acetaldehyde is an itching agent. Itching agent means what? If there will be accumulation of acetaldehyde, there will be what? There will be effect on histamine receptor. Histamine receptor. Because of that, there will be red rashes over the body. There will be nausea, vomiting, there will be headache, there will be low BP. Patient can go into shock, patient can go into hypovolemic shock, right? Patient can have GIT symptoms. So what is happening here? Whenever you already have detoxified the patient, you have informed him that you are on a deterrent agent. After this, you are not supposed to take alcohol again. But his friend came and he went for a party, he had alcohol. Now, see, now what will happen to him? You already have given him a drug which was blocking aldehyde dehydrogenase. Because of this, now there will be no further conversion of aldehyde to acetate. Now, if he is going to drink, there will be accumulation of acetaldehyde. Now, there will be what? Now, there will be effect on histaminic receptor. Because of that, in front of his friend only, he will be having red rashes, nausea, vomiting, GIT problems, right? He will be having headache. He will be having low BP. He can go into shock. This is called as what? So what was the name of that drug? That drug was a deterrent agent. That was disulfiram. That was disulfiram. This is called as the disulfiram-like reaction, right? So please understand that disulfiram blocks which enzyme? Aldehyde dehydrogenase, not alcohol dehydrogenase. Remember it. Yes, option number C. This is not an anti-craving agent. This is what? A deterrent agent, right? So this is also true. This causes accumulation of aldehyde, true, and initial dose is 250 milligram, right? Easy to understand. Now I hope all points are very much clear to you. Okay, now the next question is related to anti-smoking drug. Very, very important topic. Repeatedly asked question. So a person who was a chain smoker, he wants to quit smoking. Under psychosocial support, which of the following drug can be used? See here, I hope you remember the name of the drugs like bupropion and the varenicline, right? We are using these drugs. Please understand that out of these four, easily we can solve, okay, this is what? This is the varenicline. Okay, fine. So now let's understand the mechanism of action of these drugs. See why we are using bupropion, which is actually noradrenergic dopamine reuptake inhibitor. Because of this, there will be what? Increased level in the dopamine. See, when a person smokes, obviously he's going to take the nicotine. So what does nicotine do? Nicotine will stimulate dopamine as well as acetylcholine. Because of dopamine, he gets the kick. Because of acetylcholine, he gets the good attention and the concentration. Right? Easy to understand. So when you give bupropion, there will be elevated level of dopamine and he gets the kick. So basically he does not need nicotine. All right. Now what about varenicline? Very, very important drug. See, this is alpha 2 beta 4 agonist. It won't let the kick and craving to happen. So very important drug, right? So out of these four, which one we are going to use? Obviously varenicline, right? Easy to understand. Next question, which of the following is right statement related to a stress? Related to the definition of a stress. See, overall, what is the meaning of a stress? See, I would say stress is the response of body to anything which needs attention or action. Or I can say any kind of change which leads to physical, emotional, or psychological strain. So this is the definition of a stress, right? Okay, fine. So we have to choose one answer. Option number B, it is a type of mental tension. No, physical also. Physical response will be there. Stresses can only be external. No, see, this can be internal also, right? Option number D, it is not based on the personality and experience. No, it is 100% based, right? Different person will be having different level of adjustment with the environment, with the stress. So easy to understand option number A. See, this is an adaptive response to a situation that result in physical, emotional, and psychological strain. as in a case where person is worried about the future. Easy to understand. Yes, obviously when you will be thinking about your future, what kind of a specialization you are going to get, are you going to pass your FMGE exam or not? Yes, obviously you can have a stress. Now next question is related to SSRI effect during the pregnancy. Although SSRI is the drug of choice for depression, but during the pregnancy, if SSRI will be taken, yes, there are some side effects for sure. See, this was the multiple choice question, and more than one option was right here. Suppose if they would have asked you only one answer, say related to SSRI during the pregnancy, which of the following will be having highest risk in newborn? So yes, one option like this could have been the persistent pulmonary hypertension. But as per the research, yes, it is seen that if mother was on the SSRI, the newborn baby can have the risk of low Apgar at birth, risk of delayed motor development, risk of attention deficit hyperactive disorder. So answer will be D here. Answer will be, all options are correct. Okay, next question. A patient of schizophrenia is on antipsychotic drugs. Which of the following is not correctly matched with respect to mechanism of action of antipsychotic drugs? See, most of the questions are related to psychopharma, right? And mechanism of action of antipsychotic drugs is very, very important to learn. See here, option number A, blockage of D2 receptors in mesolimbic pathway helps in control of positive symptoms. So first of all, do understand that there are 4 dopaminergic pathways in our brain. One is called as mesolimbic tract. Another is mesocortical tract. Third is nigrostriatal pathway. Fourth is tuberoinfundibulum pathway. And there are 2 types of symptoms in a schizophrenia patient. One is called as positive symptom, another is called the negative symptoms. If a patient is having delusion and hallucination are called as positive symptoms. Why these are called the positive symptoms? Because they have good prognosis. Good prognosis. They respond well to medication. They respond well to medication. Very good. Now, what about negative symptoms? Negative symptoms like anhedonia, asociality, right? Asociality, aphasia, alogia, avolition. These are negative symptoms. So, if a patient is having negative symptoms, bad prognosis. They do not respond well to medication. Now, how there will be development of positive symptoms? Do remember, whenever there will be increased level of dopamine in mesolimbic tract, there will be development of positive symptoms. Whenever there will be decreased level of dopamine in a case of in mesocortical tract, there will be development of negative symptoms. Easy to understand? Okay, fine. So when scientists made first time antipsychotic drug, so that time it was completely D2 blocker, only D2 blocker, because in the beginning all scientists and doctors were thinking that psychotic symptoms are occurring only because of increased level of dopamine, right? So they made one drug that was D2 antagonist. Since typically it was blocking D2 receptor, it was called the typical antipsychotic drug, first generation. So this was blocking only D2. Fine. So option number A, blockage of D2 receptors in mesolimbic pathway helps in the control of positive symptoms. Now understand here, whenever there was increased level of dopamine, patient was having delusion and hallucination. Now you have given D2 blocker. Now after the medication, after the D2 blocker like haloperidol, now there will be decreased level of dopamine. So yes, there will be improvement of the positive symptoms. So option number A is right. Fine. But patient was also having negative symptoms now. When you were giving only D2 blocker, when you were giving only haloperidol like drug, fine, no. So there was decreased level of dopamine in the mesocortical tract. There was a decreased level of dopamine in the mesolimbic tract. But if you have given a drug from outside, there will be further decrease of dopamine in mesocortical tract. Now there will be worsening of negative symptoms. Now there will be worsening of negative symptoms. No? Fine. So at that point, doctors thought that we are not helping the patient, but we are harming the patients more. And there was also the decreased level of dopamine in the nigrostriatal pathway after haloperidol. There was also the decreased level of dopamine in the tibiroinfundibulum tract. So because of decrease of dopamine in nigrostriatal pathway, patient was having extrapyramidal symptom. Because of decrease of dopamine in the tibiroinfundibulum pathway, patient was having galactorrhea. Because there was increased level of prolactin. As we all know that prolactin and dopamine are antagonists of each other, right? So if one will decrease, another will increase. So patient was having galactorrhea, right? Impotency, lack of libido. So patient was having so many side effects. After many months, doctors got to know that schizophrenia is because of increased level of dopamine as well as serotonin. So now they have formulated the second generation drug that was called as atypical antipsychotic drug like aripiprazole, clozapine, olanzapine, risperidone, right? Okay, fine. So now see here, 5-HT2A, that is serotonin only, right? So 5-HT2A blockage helps in the control of negative symptoms. Yes. So this was also the true. Okay, fine. See option number C. Acetylcholine and dopamine both have a balancing factor. I should say that more potent D2 blocking effect will have less anticholinergic effect. And do remember that D2 blockade is only responsible for the what? Extrapyramidal symptoms. So option number C, yes, M1 blockage action helps in reducing EPS. Yes, this is also true. Option number D, 5-HT1A blockage helps in reducing positive symptoms and causing weight loss. Do remember here, when we talk about clozapine, right, where maximum weight gain is seen, that will be because of what? 5-HT2C blockage effect. So D is wrong. Okay, fine. So next question is related to sexual disorder, which we are learning in psychiatry also and the forensic aspect also, right? So let's solve this question. Match the following. Necrophilia, desire of having sex with the dead body. Okay, fine. One is C. Exhibitionism. All these are actually related to paraphilia, right? These are paraphilia. Sexual disorder. Exhibitionism, until and unless a person is not exposing his genital organ to a stranger, he will not get erection, he will not get orgasm. So exposure of genital organ, right? Frotteurism, rubbing against the person in a crowd to get sexual gratification. Rubbing the person in a crowd. Now, eonism. Eonism is also called as transvestism. Transvestism, right? Wearing the dress of opposite sex. So 1 is C, 2 is D, 3A, 4B. So D is the right answer. Okay, fine. So in this manner, we have solved all the questions of psychiatry. See, 13 questions from psychiatry were asked in inicet. This is a big number. Okay, I wish you all the best. Thank you so much.